you, Sadia, thank you for inviting us to share this work and for this kind introduction. We really hope today's discussion will be useful and spark some ideas or reflections from your own experience with patient and community engagement. So again, as Sadia said, I'm Anna Pujadas Botey. I'm a researcher with Cancer Care Alberta, and I'm joined by my colleagues Michelle Stiphout and Meaghan Brierly, working with Health Systems Knowledge and Evaluation Team, which is part of Acute Care Alberta. Cancer Care Alberta and Acute Care Alberta were both part of what used to be Alberta Health Services. So this work, the work we are presenting, really bridges perspectives across the system. And together, the three of us, we will walk you through how the Alberta Cancer Diagnosis Initiative approached engagement and particularly the recruitment of diverse participants. So here's how we've organized the next 20-25 minutes. I will start with some context, why recruitment deserves more attention in discussions about patient engagement, and how the Alberta Cancer Diagnosis Initiative created an opportunity to study it. And then Meaghan and Michelle will take you through the evaluation process and what we found, including some lessons we learned about recruitment strategies. Then I will wrap up with implications for practice and research. And after that, we will open the floor for discussion. And we've set aside plenty of time for the discussion, and we're really looking forward to hearing your reflections. So let's just start with setting the context for this work. There's broad agreement that engaging diverse populations is essential for equitable person-centered care. We know from the literature that when engaging in inclusive programs that when engagement is inclusive, programs are more relevant and outcomes are stronger. There's also no shortage of strategies for engagement. We've seen a lot written about co-design, about participatory approaches, and ways to reach underrepresented or harder to reach groups. But the first step, actually recruiting participants in those engagement activities, is interestingly underexplored. So there is not much discussion about how do we bring these voices to the table in the first place? How do we find and invite people who might not see themselves reflected in the health system work or who face barriers to participation in this work, right? And that's the question we wanted to explore through this work. We wanted to contribute to better understanding recruitment, a crucial yet often overlooked part of meaningful engagement. Next slide. So the Alberta Cancer Diagnosis Initiative, or ACDI, provided a great opportunity to look at recruitment in action. Cancer, as you probably know, remains a leading cause of death. Following Canadian trends, 1 in 2 Albertans will be diagnosed with cancer in their lifetime, and at least 1 in 5 will die from the disease. Over the next 2 decades, the number of cancer cases is expected to increase by more than 50%. And the cancer diagnosis process itself is quite complex, often fragmented, and associated with avoidable delays, poor patient experience, and poor health outcomes, right? So, and in Alberta, we did not have a provincial program addressing that process. So recognizing all that, in 2021, the Cancer Strategic Clinical Network, part of Alberta Health Services, partnered with people across Alberta, including patients, providers, community organizations, and system leaders, to co-design a provincial program to improve the cancer diagnosis process and the experiences. And that's the Cancer Diagnosis Initiative, right? A big collaborative effort involving many, many partners where engagement was front and center. Next slide. So the Alberta Cancer Diagnosis Initiative, its overarching goal was to improve both the experiences and the outcomes of cancer diagnosis. And to do that, the team prioritized inclusive engagement from the very beginning, ensuring that the voices of diverse populations were meaningfully included in the design process, the process of designing the program. Across the province, there were 65 engagement exercises, over 85 network connections, and input from more than 250 contributors. For us, this provided a unique opportunity really to learn from a real world effort, right? We wanted to understand how the team went about recruiting such diverse participants, what worked, what didn't work, what was challenging, and what lessons might apply beyond this initiative. And this brings us to the role of the evaluation team. And this is really Michelle and Meaghan. So I will pass it over to them.
Sorry, had to find my unmute. Thanks, Anna. And as Anna described, just to be clear, it was the ACDI team, so including Anna, who were a part of the ACDI initiative and the identification, recruitment, and engagement of these participants. And then our team was brought in to help evaluate a portion of that work. My team is Health System Knowledge and Evaluation. We go by HSKE. We are an arm's length research and evaluation team, again, previously within AHS, now within ACA. And we partnered with the ACDI team to specifically look at the engagement and design activities within the ACDI initiative. I guess ACDI initiative is included. The team members who are involved in this are myself, Michelle Stiphout, Meaghan, Dr. Meaghan Brierly, who's here today, and we also had another team member Arden Burney, who supported the analysis and reporting. We looked we were a part of the wider evaluation of those engagement and co-design activities, and then we're focusing specifically today, talking about a paper where we were again highlighting the recruitment elements within this work. So I'll pass it over to Meaghan to talk about the study. Thanks, Meaghan.
Thanks, Michelle. I'll now walk you through the methods, focusing on how we gathered and analyzed the data. So we began with the document review of 20 internal ACDI records, including the original research proposal, the project charter, various progress reports, and the activity tracking materials. So as evaluators, these planning, design, implementation documents gave us a foundational kind of understanding of how the initiative was structured and how recruitment was envisioned from the outset. So in addition to the document review, we conducted focus groups and semi-structured interviews with members of the ACDI project team. These sessions were held virtually, either in Zoom or Microsoft Teams, and they focused on these team members' roles, their experiences, and reflections on recruitment and engagement. We started with focus groups to encourage open discussion, to provide an exchange of ideas, and these were organized by affiliation. So 2 groups with internal AHS team members and 2 with external consultants. So each group met twice. All 13 team members were invited to participate and 10 were able to join. So after the focus groups, we conducted one-on-one interviews to further explore individual perspectives and to clarify themes. Now, our analysis of the data was gathered by reflexive thematic analysis, which means our goal was to generate a rich, meaningful insight. Our goal was to really understand the nuances of recruitment strategies from the team's perspective. So the approach allowed us to stay open to complexity and contradiction and to remain responsive to what emerged in the data, rather than focusing on predefined categories. This reflexive thematic analysis was also informed by the focus group guide development and facilitation. So the interview and focus group guides were developed by myself and Michelle, and while we did not conduct a formal pilot testing, the guides were refined throughout the process to remain responsive to emergent themes. So this iterative, flexible approach reflects the epistemological grounding of reflexive thematic analysis, which values researcher reflexivity and the co-construction of meaningful and thorough data management. And this brings us to analysis. So for analysis, we imported all the transcripts into NVivo and we conducted 2 cycles of coding. In the first cycle, we focused on getting familiar with the data, grouping text, identifying key topics, and this helped us shape the initial codes. We then refined the key topics after completing this first cycle of coding through ongoing discussions until we reached consensus. So the second cycle involved a deeper synthesis. And now back to Michelle to introduce what we found.
Yeah, thanks, Meaghan. So what we found was that the analysis shed light on the strategies that were employed by the ACDI project team to recruit participants from diverse patient and community groups who may have unique needs and concerns throughout their cancer diagnosis. And of course, these unique needs in some cases were also needed to be considerations for facilitating this recruitment process. So the ACDI team described approaching participant groups in ways to support connections and explored how people could and would be able to best participate in those engagement activities. And the analysis of the recruitment process ended up revealing the value of brokers, navigators, and community relations. So Meaghan and I will talk about these three strategies. So I'll start off by talking about brokers. So brokers are liaisons who help facilitate recruitment and engagement between their communities and healthcare teams. So the brokers leverage their established relationships to connect with individuals who may be difficult to reach through conventional means. And I just kind of say it that way because I'll kind of touch on that again in a moment, of course. And these brokers ended up playing a crucial role in overcoming barriers such as mistrust and language differences. And also due to the project's tight timelines, the ACDI project team relied on brokers to leverage their connections and their existing relationships. So some examples of how brokers ended up being used in the ACDI. The first example is brokers working with older adults. And so this is kind of an example of reaching participants who were harder to reach through conventional means. And I say that because the initial attempts at recruiting older adults really fell into those, again, kind of usual approaches. So that included reaching out to local organizations, healthcare providers, distributing flyers, and then reaching out to individuals directly. And those strategies weren't working. So the team ended up turning to patient advisory councils who already had established relationships and credibility within the older adult communities. And these brokers through the patient advisory councils helped by tailoring the recruitment processes and also sometimes ended up participating in the engagement sessions themselves. So they ended up also highlighting an additional potential population to be involved in these engagement activities. Another example of brokers are multicultural brokers, and these were individuals working with newcomers, and they were identified through organizations such as the Low German Mennonite Society, Immigrant Outreach Society, and African Cancer Support Group. And these brokered relationships helped overcome barriers such as language differences and mistrust with the healthcare system. And we want to specifically note here that these brokers were actively included in the recruitment engagement processes and invited and encouraged to adapt those processes as needed. So kind of framing them as being partners over than tools. This wasn't a translation service. They really wanted to access these brokers and their experience and knowledge to be able to, again, really truly facilitate meaningful recruitment and engagement. And then a third example of brokers is brokers to people experiencing homelessness or who are precariously housed. And in this case, they played a slightly different role. They actually had a protective role and ended up stepping up as proxy data sources. So they wanted to ensure the inclusion of the experiences and voices of the communities they're working with without compromising their well-being. So in this place, they ended up stepping up and being a part of those engagement activities. So there's three examples of how brokers were used as a part of the ACDI. Meaghan, on to you.
All right. Next, we have healthcare navigators, specifically those working with adolescents and young adults diagnosed with cancer. So this was an interesting finding because these navigators are embedded within the provincial care system, and they were instrumental to connecting the ACDI team with participants already engaged in care. So the ACDI team worked closely with the AYA navigators in Cancer Care Alberta and also collaborated with AYA Canada to reach out to their Alberta cohort. So one team member described this approach as finding the right expert within AHS and embedding them into the team. So this allowed for informed, responsive recruitment rather than flying blind, as that one respondent stated. And back to you, Michelle.
Thanks, Meaghan. And then our last recruitment strategy we wanted to talk about, we framed as community relations. And you'll see that this is another type of kind of brokered relationship, but with some kind of distinct differences that, of course, we will highlight here. So to include the perspectives of members of Indigenous communities, the ACDI team reached out to AHS's Indigenous Wellness Corps. So the Indigenous Wellness Corps, or the IWC, was an AHS provincial program, and they're now situated with Primary Care Alberta, and they are focused on supporting Indigenous health needs and topics and building partnerships between AHS and Indigenous communities. So the IWC were contacted by the ACDI team to facilitate recruitment and engagement. And the IWC ended up brokering knowledge in distinct and important ways. So similar to the broker role with the precarious and unhoused communities, the IWC focused on the necessity of building strong relationships and having sufficient time to ensure meaningful engagement within the ACDI. So they ultimately felt that the timelines were too restrictive, and so they ended up referring the ACDI team to a substantial body of research that had already been conducted. So there are multiple important factors at play here. Of course, the first is prioritizing strong relationships, which we've touched on already, but then also the commitment and emphasis on ensuring that if folks are engaging, that there's enough time to support meaningful engagement if they are involved. And then, of course, that additional important piece, as they referred the ACDI team to existing knowledge, is ensuring that engagement and data collection is contributing new information, if information already exists, so you can build on top of it. So a quote that came out of the interviews here was, we didn't actually complete the Indigenous engagement piece, and I think that was okay, because if we had just tried to do it without the advice on how to do it, we wouldn't have been successful. So now we've been able to just start to bend the curve a little bit on opening that door for us to continue with engagement with these populations. So those are the three recruitment strategies that were highlighted. In addition to the recruitment strategies, there were also a number of considerations. Perfect, thank you. And so these considerations that we're highlighting here are recognizing intersectionality, language, time and relationships, and flexibility and a willingness to learn. So the first consideration here, intersectionality, is a basic yet complex one. And when I say basic, of course, we understand that people don't just fit into one identity. And so what they ended up finding in the ACDI was that the proposed groups of participants overlapped and their experiences were not distinct. So this came out early when trying to identify groups for recruitment, as well as in the engagement activities themselves, where participants would identify and share experiences outside of the group that they were, technically classified to. And I wanted to share another quote that came out of the interviews and focus groups describing the recognition of intersectionality as, it wasn't as cut and dry as I'm in this group, I'm in that group. Things overlapped. People were more intertwined in that way. Often the way people describe themselves is more informative than the checkboxes we wanted to put them in. So that lenses piece really just became the way we started our conversations or engagement. And so it was really just an opportunity for people to describe who they were. The next piece is language. So, of course, language is an important consideration to address to ensure participation in the engagement process, and not just limit, so that the engagement process isn't just limited to participants who are comfortable communicating in English. So in this way, the assistance of brokers was not only essential in facilitating access, but also ensuring they were being recruited in a way that worked for them and wasn't just easiest for the study team. So this included translating material and also ensuring appropriateness and understanding of those materials and of the engagement process itself. And then the next piece, again, we've touched on with those brokering components, as well as time and relationships. So this was very notable in the protective response from the homeless community brokers and the Indigenous Wellness Corps. And there was really that emphasis on relationships and safety, which prior to engagement. And of course, this was also reinforced by the success of the patient navigators and the fact that they could work on existing relationships to support that engagement. So again, I keep saying this is complex and basic, but yeah, it makes sense that these it makes sense, but that doesn't mean it's easy, right? To try to consider time and relationships in recruitment and engagement processes. So I guess just kind of a final note around this is that the ACDI team members interviewed acknowledged that the timelines were, that some of the timelines felt too tight for the ACDI engagement, and they would have appreciated the opportunity to extend the engagement period, recognizing it took longer than anticipated to build those relationships. And then the final piece is flexibility and willingness to learn. So a lot of the recruitment strategies outlined on the previous slide were applied based on being willing to learn and adapt. So there were strategies that were tried and worked with one community, but not with others. And the project team's reflexivity and willingness to adapt was an important aspect of the recruitment, both in this initiative and when considering where to start for future engagement opportunities. And just a kind of a couple snippets that came out of the interviews and focus groups that I feel like really speak to this are, we course corrected an awful lot, and the idea of letting go of preconceived ideas and actions. So that takes us to taking a look at what's new. Great. Thanks, Meaghan. It's really hard to come into this situation and say that recruitment's new. Of course, we don't think that recruitment is new. We've all done it. We know that it can be challenging. But again, as Anna had noted in the introduction, we did end up finding that it was an underexplored step in patient engagement. And so, yeah, we just kind of wanted to use this opportunity to share the learnings from this project and also be able to explore further, particularly with this group, other experiences and kind of how we can keep considering and being really intentional in that recruitment process. And again, that speaks to these other components here, the recognition of intersectionality in recruitment. That it was recognized as a part of this project, and we'd like to also consider how, in those early stages, it came up and was a way for people to identify themselves in the engagement opportunities. But how do we also consider that in the recruitment process? What is it about those intersecting identities that may need to be considered, both in terms of inclusion, safety, how people would describe themselves to fit in different groups? And so that's just kind of an element that we think is potentially exciting and necessary to explore. And then touching on that piece that we described before in terms of the community relations, also really emphasizing that existing knowledge can be, of course, more ethical than new engagement. And the idea that there is, particularly with these groups that were, that there was that protective factor, ensuring that you have collected information that does already exist so that you can build on that and collect new information when reaching out and engaging with these different groups. And then the last piece here is just a transition to Anna's next slide. We're talking about the implications, and that's taking these practical lessons out of this project and these learnings and being able to apply them to other health system improvement initiatives and programs and those types of things. So I'll pass it over to you, Anna.
Yeah, thank you. So building on all these that Meaghan and Michelle said, right, and to wrap up, I will touch on this, what all these findings mean moving forward. So what does it all mean for practice and research? From a health system perspective, one of the clearest lessons is the need to invest in long-term, trust-based community relationships. Recruitment can't not be something that we do only when we need participants. It depends on infrastructure and continuity. And supporting the roles of brokers and navigators as part of that infrastructure, not just as ad hoc partners, right, is crucial. And as Michelle and Meaghan highlighted, adopting an intersectional lens early on helps ensure recruitment strategies done unintentionally exclude people who experience multiple forms of otherness. From a research standpoint, we need to emphasize that there is value in studying recruitment more systematically, not treating it as a logistical step, but as a component of the engagement practice. So there is a real opportunity to evaluate recruitment. We need to study how people are recruited, not just who is recruited, who participate, right? And we need to include patient and community perspectives in that process. And that's key, of course, to building equity and authenticity into engagement. And next slide. And yeah, with this, thank you, Meaghan. With this, we would like to end with some discussion. And these are a few questions we came up with, we thought might get us started. And we will leave them on the screen during this period of discussion. But really, we would love to hear what's on your minds, whether it's about recruitment, engagement design, or broader implications of this kind of work. And of course, we are happy to answer any questions you might have about the study itself. So thank you.